Hi, I'm Dr. Allie Green of PurelyIntegrative.com. I'm a primary care pediatrician who utilizes all of what modern medicine has alongside with holistic medical care for the care of my patients. My supplement business started as a way to help parents choose safe and effective products for their children. It's grown over time to incorporate a staff of knowledgeable people who can help you in choosing those products, a customer loyalty program, and an easy-to-navigate website. We do these videos to address common pediatric problems that you encounter with your children and ways that we can utilize holistic care in treating those. Today we're going to talk about the common pediatric problem of constipation. Constipation is really important because we have lots of things that we want to accomplish for our children, and we talk a lot about detoxifying our body from our environment. And your body has natural ways of doing that, and stooling every day is one of the biggest ways that your body says, these are the things I don't want in my body. And when you don't do that every day, your body has the opportunity to reabsorb them into your bloodstream and recirculate them. So the most important part of detoxification is actually just take out your trash every day. So that's what I say to my children, like, you need to take out your trash every day and get rid of the things that your body doesn't want to have. Sometimes that's harder than we think it should be. And when we address this, we're going to talk about both the habit of constipation and the causes of constipation. You really can't address a child with constipation without understanding these two issues. Today, we only have time to talk about the habit of constipation, but in our next video, we'll address the causes of constipation as well. If there's one thing I want you to get out of today, it's that addressing the habit of constipation is the first job. And it can take some real commitment. Your body gets into habits and rhythms of things, and to fix the habit of constipation takes about 6 to 8 weeks of steadily stooling every single day. I'm going to explain that to you a little bit in a bit, but in the meantime, let's talk about what children look like when they present to my office with constipation. Sometimes parents actually realize their children are constipated and they come in and tell me, I think my child has some constipation and needs some help. But frequently that's not what they come to complain about. Many times they tell me that their child's waking up at night and they're not sleeping well. And that's because your bowels are very active at night. You do most of your digestion and movement of your bowels while you're sleeping. A lot of people don't know that. So if you're constipated, as you go to try to move the stool through your bowels, it hurts and it will wake children from their sleep and make them disrupted. Of course, that can make them tired and grouchy during the day. Everybody knows children need to sleep. It can also present with actually a complaint of diarrhea and belly pain, and parents are concerned that their children have legitimate, serious concerns of chronic diarrhea, because if you have a large piece of stool in your rectum, your body many times will leak some watery stool around the outside, and the children have no control over their rectal movements at that point, and so they leak stool into their underwear and often rush to the bathroom because they realize that they don't have control. So the complaint coming to the doctor will be diarrhea and belly pain, when really the actual problem is this obstructive piece of hard stool in the rectum. We also have children who present with poor appetites because, you're not going to eat very well if your belly is already very full. And sometimes the complaint is just that they are distracted and off task, which if your belly hurts and you're not clearing out the toxins in your body each day, that can present that way. Constipation oftentimes comes alongside other neurological conditions like autism or anxiety, and so that of course complicates it as well. And nothing makes me sadder than when people tell me that a child's anxiety is causing their belly pain when really their belly is constipated and they're having actual pain that we can alleviate for them. And because those two come together so often, we look at treating it as also a way to reduce their anxiety. Our bowels like habit. Everything in our body actually likes habit. We have, a sleep-wake cycle we refer to as our circadian rhythm that's controlled with hormones and signaling that goes on in our brain. We like to eat in habits, and our body goes through these cycles of like eating at certain times and in a rhythm of life. Our body really likes those things, and stooling is one of those things that happens in a habit. When it's going well, you should stool once a day with an easy-to-pass stool that doesn't cause pain and is a small caliber, easy-to-pass stool. And if you're not doing that on that regular basis, kind of around the same time each day, there's probably not exactly the right signaling going on. In the case of chronic constipation, when the stools get really large, what happens is your stool comes down into your rectum each day after it's gone through the process of digestion and through your small and large intestines. It'll pass into your rectum, and there's these stretch receptors in your rectum that actually stretch to say, wow, there's stool here, and tells your brain, oh, you should go to the bathroom. Under the right circumstances, that should be a kind of calm situation, like your body goes, oh, I need to go to the restroom, but not an emergency. And then when you get the opportunity to go to the bathroom, you can go and pass your stool easily. If you have chronic constipation and you have hard, large stools in the rectum, which can happen because a child gets in the habit of holding it, maybe it hurt a couple times and then they don't want to go, or maybe they have some cause of constipation that we'll talk about next week, but whatever it is, they have this large piece of stool in their rectum and they've now stretched it to the point where the receptors don't work. So now they don't get that nice little signal that says, hey, you should go to the bathroom now. They aren't getting any signal at all. So you'll see them kind of run to the bathroom, or they'll have to work really hard to go, and it doesn't seem the same as everybody else's signal, and it's because it's not. So in order to help your body get back into signaling into that rhythm, you really have to pass soft, easy, daily stools for at least 6 to 8 weeks till the rectum can shrink back down and trigger those receptors to work again. That's where the commitment to a long time really happens. This is when you have to settle in for the long haul to retrain those receptors. If you don't understand that, then you might be putting lots of effort into trying to fix your child's constipation through diet changes or supplements, or possibly even giving them enemas or a lot of laxatives, but you're not doing it on a regular basis. And so it just feels like you're on an uphill battle and it just keeps recycling. It's really this commitment to daily treatment over a long period of time that helps our body push the reset button and start to cycle in a right signaling pattern. Until you do that, it might feel like the other things you're doing don't work. So this is how we have to address it over a long period of time. Softening the stools is step number one. And then we also can incorporate in some stimulants to actually help the stools move along. From a natural perspective, the options that we have available are aloe and magnesium. Both of these products in some way attract water into the stools and keep it soft. In the case of aloe, it of course has some soothing properties, but it also attracts water into the bowels. Our aloe water is a really nice alternative to Miralax if patients have been given that option and don't want to do that. And the aloe water is very palatable. It tastes like water, which is very different than aloe juice. Most children don't really like drinking aloe juice. It's very bitter if you've ever had it, but this is nothing like that. And then we also have capsules with concentrated aloe. If you take those capsules, you have to drink them with a lot of water because it needs both the water and the aloe to work. We also have magnesium, and in the case of constipation, it's really important that the magnesium actually have the positive charge on it. That's like the natural ionic magnesium, nothing fancy. But then getting children to take that sometimes is tricky, so we've worked really hard at trying to find ways that children will be able to take the magnesium over a long period of time. Magnesium capsules, of course, for people that can swallow are a good option. We also have Calm, which is kind of a sour little mixed drink in different flavors. Some kids like that flavor and they just love the Calm. Some children don't as much, so you kind of have to know your child. And then we also have the Magnesium Easy Sticks, which are super yummy. They are like pixie sticks, and so almost all of our children will comply with taking those. And in all of these products, we're using the magnesium as that osmotic gradient to pull water into the bowels and help it be softer. What's really nice about magnesium is it also has a whole bunch of benefits to neurological conditions. So we use magnesium in patients with chronic migraines or anxiety or sleep troubles or just agitation and hyperactivity. And so if I have a patient who is both constipated and struggles with those, magnesium is a great option for a treatment for them. Sometimes you're softening the stools into a nice, soft, kind of like mushy texture, and you still need help moving the stools along. And in that case, we use stimulants for that. One of our favorite products is Ready, Set, Go. Ready, Set, Go is a very yummy, easy to get children to take version of prune extract and caraway and fennel that helps them with actually moving the stool through quicker. If we use that in the evening because the stools are active at night, so this is kind of helping them during their natural state, and then we hope that they'll stool in the morning. Some of my families will use this every day during these early stages of creating a new habit for constipation, and then other families will just use it to say, well, they didn't stool today, and I know they didn't go all day, so I'm going to give them some Ready, Set, Go in the evening so that we can keep things moving on. Whichever way you use it, it's safe and effective. When we're done with that 6 to 8 weeks of soft, easy to pass stools, then we can wean ourselves down, or we can start to address the causes of constipation that got you there in the first place. We're going to cover those next week, but if you aren't committed to that process of treating the habit first, you'll kind of find yourself stuck with trouble. So if there's anything I want you to know, it's that be committed to this longer process, and you'll find yourself far more successful in treating your child's constipation. If you have any more questions of products we talked about today or other products, our knowledgeable staff are available at purelyintegrative.com. Thanks.